So I work with the medical clinic out here once a month. I'm a physician assistant on my daily job in the world. And so I come out here once a month with the medical clinic, and we see patients, both acute, so sick now patients, and chronic follow-up, so manage their medical needs. We're able to run it with the pharmacy and see the patients and treat them for what they come in for. I just come once a month for now. So we run our clinic, that clinic on a Monday night, and so I'm the third Monday of the month. And so me and one of the physicians I work with come out here and we do that clinic together. So through the medical side, we're not only able to give care for patients when they need it now, so we'll have first-time patients come in, maybe they have the flu or maybe they have an infection, so we're able to treat them. But we also do have regular patients that come back and see us once a month or every couple months for their blood pressure or their diabetes or just their chronic medical conditions. So we're able to almost fill that role for them as far as needing a physician or a care team, a PA that's able to follow their illness and help them. We are able to have access to medications. We have an in-house pharmacy, which we stock. We have a pharmacist that volunteers with us, and she's amazing. And then we do also have access to give them prescriptions for medications that we don't have. Follow some of the programs through the community to help gain that way, or through the insurance programs or prescription program. And then we are also able to get blood work, testing done sometimes. We've had a few patients who had pretty significant diagnoses, and through some of our partner programs we're able to get thousands of dollars of treatment for free because we were able to catch it here and get them to the right place through some partner organizations. We've had a few patients whose care has been hugely impacted when they've come here. One of the physicians I work with will tell you he had a patient that needed a very major cardiovascular surgery done, and he was able to get that covered through a program that we work with. But because they came here and he identified it, we're talking about thousands and thousands of dollars of this surgery all for free. Hospital stay was free and everything. I think for me the biggest part has kind of been, I do actually, and I see patients every day of the week at my regular job, but I come out here and I'll have patients that come back on a Monday night when they know we will be here, because they do look at us like we're their care team, and they think, oh, my appointment's on the third Monday night of the month at the neighbor's clinic, and so they come back in. And so I think that just being able to be that kind of repeat influence for them, and just know that they can rely on us here, and that we have been a staple. And I've only been out here for about 3 years, but they've been 3 great years, and I've seen people time and again, and they come in and I check in with them on how they're doing. And so I like that they can think of us as their doctor's office, and so I like that. And I think for me that would be the biggest thing, of the impact I feel like we're having. When you don't have access to care and access for your health, I think when you don't have something, you forget how much of a burden that becomes on you and how much you think about it. So as people are wondering where their next refill of this very common medication is going to come from, but they're able to come and get it from us, I think that that's so helpful for them. So.